Hello everyone, I am Subhi Dhupar and I'm the Regional Director for United Religions Initiative. And it's an absolute pleasure to present on session 2, which was on people, community resilience, and their journeys. And I think this um, piece on community reflections was something that really brought forth some of the experiences that faith leaders have been able to really capture well in terms of countering stigma and discrimination that people living with HIV and other verticals face. But there are also some of the key suggestions that came forth from the community that could be worked on. Faith leaders are being one of the key stakeholders are still coming together and trying counter stigma, discrimination, and also work for the human rights of key populations and marginalized communities. Some of the reflections that the speakers shared was actually the fact that each of them have had a very difficult journey in terms of when they were first tested, and increasingly over the journey of resilience that they've had, um, each of them countered different set of problems that included the hierarchy in the faith-based institutions that they had to counter to spread awareness. So these were some of the challenges that people faced, in addition to the common problems and stigma that people living with HIV face. So there are these myriad and complex amount of problems that each of them definitely faced, and I think it probably these lived experiences correlate to many more such people who are at the moment facing or are discovering the fact that they have contracted HIV/AIDS. Having said some of these highlighting some of these problems, um, faith institutions have eventually, over a period of time, responded in different capacities. While some of the common stigmas and some of the discrimination has actually come from faith institutions, their community members have also experienced the fact that many institutions such as churches, synagogues, temples, mosques have also been the places to actually carry out awareness programs. They've also been the ones who have actually provided a lot of support in providing a cohesive and an inclusive environment. These faith communities have been instrumental in countering many such taboos, many such stigmas that people face. There has been many different levels and layers to which these services are being provided by faith-based institutions. So there is definitely a call for a minimum standards of health. There is definitely a call of more intensive, invasive, faith-based interaction.